NUCCA is a form of chiropractic focused on correcting small misalignments of the neck. The goal of correcting the neck is to restore optimal balance to the entire spinal column and the rest of the body. Research over many years has shown that improving body balance effectively reduces stress throughout the body and can help to alleviate health problems. This is because the NUCCA procedure can influence one of the highest control centers over body balance, the brainstem and central nervous system. By affecting these systems, the NUCCA procedure essentially helps to get your head on straight and allows the rest of the spine to align under it. Because the spinal column protects the central nervous system that controls and coordinates all body functions, good spinal balance is critical to good health. NUCCA, which stands for the National Upper Cervical Chiropractic Association, brings balance back to the body. There are many things that can add stress to our spine. Motor vehicle accidents, falls, sports injuries, repetitive motions, lifting, and even sitting for too long are just a few of those things. Plus, the various stresses of day-to-day living can alter our body balance and produce health problems. After an injury or stress to the spine, the muscles supporting it will respond by tightening and distorting. The body and spinal column become distorted and less stable. With the spine now locked in a stressed position, every movement becomes an imbalanced movement. This added stress can often produce a variety of symptoms that can significantly interfere with the enjoyment of our life. The NUCCA organization has developed a very precise procedure to correct this problem that is based in mathematics, physics, and biomechanics. The first neck vertebrae, also known as the atlas or C1, is a small gasket-like ring located at the top of the spine. It is in close proximity to the brainstem, which is the part of the central nervous system responsible for controlling a number of vital body functions. One of these very important functions is the muscle balance of the spinal column. When the atlas is subjected to stress or injury, it can become partially misaligned in relation to the skull and the other vertebrae in the neck. We call this the atlas subluxation complex syndrome or the ASC syndrome. Even a slight structural misalignment of the upper neck will result in a muscular response that shifts the body balance from normal and adds stress to the spinal column. By making these subtle adjustments to the neck, it is possible to reduce this misalignment and improve body balance. When you visit a NUCCA chiropractor, you will have an extensive evaluation. Since the severity and type of each spinal misalignment is completely unique to the individual and how it affects their body, the NUCCA procedure begins by taking a detailed health history. This includes your chief complaints, the location of symptoms in the body, how they began, and how long they've been present. Any other health problems, injuries, motor vehicle accidents, surgeries, along with other treatment programs, which include diagnostic testing and x-rays, are evaluated and assessed. After this initial process, your doctor will begin the steps necessary in determining if your spinal column is significantly misaligned or out of balance. You will be asked to lie on an adjusting table, and your doctor will check for a leg length imbalance, which is also known as a short leg phenomenon. This is where the leg is not really shorter but appears shorter because the hips are imbalanced. Precise measurements of your spinal balance are taken. These measurements are used to determine if you have a significant misalignment that would require a correction. They are also used to determine the progress of your spinal stability on follow-up visits and help in determining when spinal correction is needed and when it isn't. If it is initially determined that you have a significant body imbalance, a specific series of x-rays is performed and mathematically analyzed before your first correction. To obtain an optimal correction, these precise mathematical calculations are used to determine the proper direction for the spinal column to return towards normal. The correction is unique to each patient, and the x-ray series is a critical part of ensuring accuracy and also that a successful correction is achieved. The NUCCA series involves safety procedures that use low technique settings along with specifically designed filters to further reduce radiation exposure to the patient. When it is time for your first spinal adjustment, your doctor will have you lie on the adjusting table on your side and position your head in a very specific fashion. This is based off the information obtained from the x-rays. Your doctor will be positioned at a specific stance, again determined by the x-ray analysis, and will place their hand near your ear. This is where the side of the atlas or first neck vertebrae is located. Your doctor will apply a number of light and subtle corrections that move the spinal bones of the neck very carefully. It takes very little shifting of the bones to relieve nerve pressure. The precision of the procedure means the spinal correction is subtle in its application, but the positive effects on the nervous system and improved body balance are not. Because it's important to receive the best possible correction on your first visit, the doctor will take 2 post-X-rays following your initial correction. These post-X-rays will show your doctor how your spine responded to the adjustment. This is typically done after your first adjustment. If the X-ray measurements indicate that the correction was not optimal, your doctor will continue to readjust you until a favorable balance is achieved. We know that the better the spinal correction, the better the chance of recovery. Because each spinal correction and healing process is unique to the individual, you'll be monitored closely with follow-up visits. These visits help to ensure the spinal correction is maintained for as long as possible and the healing process continues. Correcting and stabilizing the spine may require a number of adjustments over a period of time. The NUCCA measurements used in the NUCCA procedure, such as the initial pre- and post-X-rays, leg length checks, and spinal balance measurements, help to monitor the recovery process over time. It is helpful to remember healing is a process, not an event. Recovery continues as long as the adjustment or correction holds and optimal spinal balance is maintained. Adjustments are only made when the body demonstrates a significant misalignment. After the spinal correction, you will want to be mindful of what you are doing during the initial phase of the healing process. Your doctor will help you to determine what you can do to help maintain your correction. Being adjusted as few times as possible is ideal. When it comes to offering help for spinal-related problems, we know that no one procedure offers a 100% solution. However, NUCCA's track record of success in restoring and maintaining good spinal health makes it an excellent path for many people. If you have questions on the importance of good body balance, its influence on improved nerve function, or NUCCA's ability to help with your specific needs, reach out to a NUCCA doctor in your area to learn more or schedule a consultation.